All right, guys. Hello, welcome back to Pharmacists Out of the Box. I'm Bryn.
I'm Heather.
And today we have a special guest, one of my friends, Jennifer Silliman. She has a documentary she put out in 2015, The Dark Side of the Full Moon. You guys might be asking, what is she doing here? She went with her passion and recorded this documentary about moms that have postpartum depression, postpartum anxiety. And to me, it's a topic that pharmacists are in the front line to see and experience. We get to see patients firsthand and new moms and look at this beautiful new baby, but how is mom doing? And so to me, this really opened up my eyes when I had my son. We had a mom's group and they organized a viewing of her movie, and I was just blown away. So I really am an advocate for pediatricians, pediatric nurses, pharmacists, pretty much any healthcare professional to view her video. So she's going to tell us a little bit about it. And she is in South Florida. And you want to explain a little bit about how you even got into?
Sure. So the story of how me and my producer met is actually part of the film because it was such a unique way that her and I met to actually do the film. So she was actually coming to film my daughter who lives with autism. And my daughter's nonverbal, but she doesn't have a lot of the, I guess you could call distracting behaviors. So she was like the perfect candidate to be filmed for a training video. Maureen was put on that project and came to my house and filmed my daughter and then turned the camera on me and just said, hey, tell us a little bit about yourself. And of course I was running mommy support group. So that's what I told her about. I wasn't working full time. I was just a stay-at-home mom running support groups. And she said, oh my gosh, when I was pregnant, I had depression and anxiety, and I've been wanting to make a documentary film about it for like 5 years. And I was like, well, let's do it. I mean, we have to make it. And so 2 weeks later, she was back at my house and we had scoped out the entire plan to get this film produced and out to the public. So it was a whirlwind experience. I mean, the movie was completed in about a year, and that includes everything, which is unheard of. We were traveling every weekend and sleeping on people's couches because we had no budget, and and so we just made it work. I mean, we literally packed our cameras and lighting equipment. We wrapped them up in yoga mats and shoved them in suitcases. And we would weigh the suitcase and be like, can you take some of your shoes out? We're like, there's no shoes in there. We're like, it's your equipment. So no, we can't take anything out. So it was a really tight budget. It ended up costing us about $250,000 to make.
Wow.
But we had a lot of in-kind donations where people just donated their time, our sound guy and our production staff and stuff, because they realized how important the film was. And it was so interesting because a lot of them said, oh, my wife dealt with this, or oh, I know my sister had this, or I had this and I didn't know what it was. And so they were more than happy to donate their time to have this very first film, which is unreal. That was even the first film that was out about this topic, which is so very common. Yeah, that's kind of how it came about. And then for us, we really didn't have any idea how it would explode the way that it did, and made it very clear that we didn't want to make a film for moms. We wanted to make a film for providers. So, and we always tell our provider or anyone who wants to see the film or buy the film, we say, just so you know, this film is filled with triggers. Do not show it to a mom that you think might be experiencing this because that's unhealthy. But it's important to show to pediatricians and OBGYNs and nurses. And so we have many universities that buy the license so that they can show it to their classrooms, and really kind of teach an entire curriculum around this subject based on the documentary, which is full of stories of five different women who had very different experiences all across the country, and how it really just doesn't, it can affect anybody. Kind of like you said, I mean, it doesn't matter. It doesn't matter if you have health insurance. It doesn't matter if you're Black. It doesn't matter if you're white. It doesn't, none of that matters. I mean, even if you have a ton of support or no support, I mean, it's just none of that matters. And so it is important for health providers to be able to recognize and at least have a conversation with a mom, and she's experiencing it.
Yeah, I was definitely surprised. You did a really good job, bringing in all sorts of people, just different different places in life, different birth experiences. Like it just made me realize like you really have no control. And even the timeline, like there were some moms that didn't even experience postpartum depression or mood until like months later. Mm-hmm. And so it was kind of like, as a healthcare professional, you're like, oh, well, they had a baby, they're fine, but you don't know that. You don't know what's going on. And a lot of times they're in with their pediatrician, getting that baby checked on. And that's a perfect opportunity for the pediatrician to be like, Mom, how are you doing? Mm-hmm. Like, get that conversation.
Yeah, absolutely. You can't tell by looking. That was one of our big kind of sayings at the time, because I think, especially for me personally, I was really, really good at like putting on the mask. Mm-hmm. Why like the film poster is like the girl with taking the mask off who's pregnant, because it's so true. I mean, I was able to hide all of my symptoms very well. I did it for 6 months, and for 3 of those months I was pregnant. And I delivered my daughter and was still I was symptomatic in the hospital and was still able to hide it from all the nurses, because I didn't know what they were going to do. I mean, I was scared they would take my baby. I mean, we hear that all the time. And I thought the same thing. And so I was really good about just putting on enough makeup to look like I was alive and brush my hair and put like real clothes on with shoes and put a smile on my face and say, yeah, everything's great. Baby's healthy. We're so excited. Mm-hmm. It's easy to do that. And then it's even easier to make it through a whole appointment like that if the doctor doesn't ask anything. Because I think for me, and I mentioned this in the film, that if just one person would have said, hey, and like touched my arm, like, hey, how are you doing? That would have been it for me. Like the makeup, none of it would have mattered. I would have completely crumbled and told that I get chills even thinking about it. I would have completely opened up and shared everything, no matter what would have happened, in a heartbeat. But nobody did that. Not even family. Like nobody really sincerely looked at me and said, hey, how are you? Like, is everything okay? And I think that's so important for us to do, especially now with how communication is with technology, and we're texting, and there's like, we don't even say how we feel.
So
we post
personal.
emojis. Like, it's just like, oh my gosh, and so, but then when people would come over, they just wanted to hold the baby. Like there was no like, hey, like there was no kind of intimate touch between me and like family. Like it was very like all to the baby, all to her. And while that's great, when you're experiencing what you're experiencing, it's almost hurtful in a way. But then you're like, well, maybe, and then you start blaming yourself. Like it's the whole
I'm just being selfish. Like, yeah,
I'm just being selfish. Like this obviously is not about me. This is about my baby. She's healthy. She was in the NICU for 10 days, and she's great now, and I shouldn't be upset about anything. I have a great husband. I have health insurance. I have a home. We have got beautiful nursery. Like, what is my problem?
Right. What's wrong with you?
What's wrong with me? Like, why can't I get over this? So yeah, I mean, it's a horrible thing to go through. And that's why I share it. Because I think sharing my story, I know when I was running support groups, and I don't think this is in the film, but this is kind of like a little behind the scenes. So when I was running support groups, I had a mom who showed up and did not talk much during the support group, but was crying, like visually, I could see that she was upset. But she didn't talk through the whole thing, and I never pushed people to say anything. They were more than welcome to just listen. And she got upset when she was listening to my story about the intrusive thoughts and just like, finally getting on medication, and despite the side effects, took the medication, because if not, I, wouldn't be here doing the support group. Like I needed all that. And it was the end of the group, and we left, and she got me in the parking lot. And she said, I know that you said you were not going to say what medication they put you on, but would you mind telling me which one? And I was like, okay. I just felt like there was something more to whatever was going on here. And I said, well, they put me on Risperdal, and it's an antipsychotic. And she goes, oh my gosh, I have a script for Risperdal in my purse that I did not have filled because I read all the side effects. And then I read who it's really for. And I'm not schizophrenic, and I'm not bipolar. Like, that's not me. Went went and got it filled, and her intrusive thoughts went away in like a week.
Wow.
So I knew at that point, because I hadn't even met Maureen yet, I was like, I knew that just by sharing my story,
You were helping.
save people like this. I mean, and that's all it takes is for me to share it. Are you kidding me? And I've always been a person who like wore her emotions on her sleeve and was not scared to share like anything with anybody. And coincidentally, I went to school for broadcasting. And so like it kind of brought everything together with the film. And I was like, yeah, let's not only like do the film, let's just like scream it that this is something on and we need to help. So that's a little like behind the scenes, like what
Yeah,
I really realized
story behind the story.
The story behind the story. So, and it's so nice because I'm still friends with her and she's doing great, and it's pretty incredible. So,
yeah, you have a really good way about you to take the shame away from it. There's like this automatic like shame element that comes on you as a mom. Like no matter whether you're experiencing depression, anxiety, I mean, you didn't do this right for your baby, you didn't do that. There's so much pressure and shame surrounding that. So to take that off and give women the okay, like it's okay to have these feelings, there's help available, and to be able to share that with them is such a huge support.
Right. Absolutely.
And I notice a lot in society, we remark on like the women, oh, you've lost the baby weight, you look great. But I was like, even surprised, like they never asked like, how are you doing mentally? How are you holding up? Are you getting enough rest? I mean, no one is, but just to be asked.
Right. It's nice to be asked at least. Yeah. I mean, even in the recent, I don't know if you saw with Meghan Markle, the new royal, how she was recently interviewed by someone and he had said, so how are you doing? And she goes, well, I just first want to thank you for asking me because no one has been asking me how I'm doing. And she even got ridiculed for that because she's a royal and she's got support. And she said, why wouldn't she be doing okay? Because she's got everything she needs. But it's not about the material things that you have. It's not even about the mental support and emotional support you might have from your family because it has nothing to do with any of that.
Right.
I mean, I was sick.
Yeah.
I mean, I was sick. Like my brain, like things were not working properly. And I always tell people there's a big difference between having a bad day and being depressed. Like those two things are very different. And I have friends even still who look home and be like, oh my gosh, today was so horrible. I'm so depressed. And I'm like, no, you're not. Like, you're not depressed. Like you don't know what being depressed is. So don't even use those words. And I think that's kind of where things have gotten a little gray is that people just think, well, when I have a bad day, I can get myself out of that. I can go for a run. I can call a friend and talk to them about what happened. I can wake up the next day and just kind of forget about what it was. But when you're depressed, medically depressed, that's not happening. I'm not sleeping that off. It doesn't, for me personally, and I think for a lot of people, it doesn't go away unless there's some sort of intervention. And that isn't a bath. That's like, I need either a professional to talk to, or I need medication. And I'm very pro medication. I mean, if it works for you, do it. And I have so many, and that's the other thing too, is that along with the stigma, even when moms reach out for help and the physician feels like they would benefit from medication, they don't take it because you lost all that baby weight, but guess what? The side effect from this antidepressant, you're probably going to gain some of that weight back, right? And so they don't want to take it because of that. So even if they do reach out for help and then ultimately the treatment might be medication and they don't want to take it, or they're breastfeeding, the whole breastfeeding piece is like a whole other piece where, well, can I safely breastfeed on this, that, and the other and whatnot. So there's so many angles to this, specifically mental health and being a new mom, that I think that's a big reason why professionals don't tackle it, because it's just like, oh my gosh, if I ask her how she's doing and she says, I have all these things going on, like, what do I
do?
And that was a big thing for us is like, well, how do you not have a protocol for that? Like, I mean, because maybe it's not a pregnant mom. Maybe it's somebody else who comes in, whether it's suicidal or whatever. Like, what is your protocol? Like, how do you not have a protocol? I mean, I know it doesn't happen often, but when it does, it's a serious situation. And I nurses reach out to me who knew about my film and who kind of knew me through the community, like local nurses. And it just happened actually like less than 6 months ago. She goes, we have a patient in the office right now who says that she doesn't want her baby anymore. And you were the first person I thought of to call. And I'm just like, oh my gosh, I'm just like I'm a nobody when it comes to like I don't know. Call 211. She's in danger of hurting herself or someone else, call 911. But she's like, you were the first person I thought of. You would know what to do. But the whole thing is professionals need to know what to do. They need to know what to ask. They need to know what to do with the answers that they get. And they need to know how to get the answers out of moms who might not be telling the full truth, but, and a lot of them don't. I mean, they lie on the Edinburgh, they lie on all of those, assessments that we try to give them to identify the depression or anxiety. They lie because they're ashamed, right? Or they might just not believe them if they say something, or they might take their baby, or they might lock them up, or they might whatever. And so, they need, we need to have the conversation. I mean, it has to be had because, like you see in the film, I mean, mommies die. And that's how serious it is. It's crazy.
So Jennifer, I'm just curious, this is a question that came into my mind. Is it because some of the mental health things we can follow through families, some of them are kind of have a genetic factor, it seems like, or at least a family inheritance kind of thing. Is that true? Do you know with postpartum depression? Like if you've had okay.
Absolutely. And that's one of the risk factors that we talk about. So if you've had a history of, mental health issues yourself, or if an immediate family member has had them. I remember when I first kind of came out to my family about everything, my mom was like, and she was a teen mom, and she's like, all I thought about was just getting in my car and like driving it in the river and just ending it. And I had never known, I didn't know she had ever done. And I think the thing about that is that moms aren't telling their daughters, this is what I went through when I was pregnant with you.
Right.
That conversation's not coming up. I mean, we don't even want to like say that, because how is that going to make them feel? But it's like saying anything else. If it was a physical thing, like, yeah, I had gestational diabetes when I was, pregnant with you. So here are the things you look out for, So, that's something that you would say to your daughter, hey, I had postpartum depression with you, and here are the symptoms. There's a good chance that maybe you might have that too. Here's a plan we can put together to make sure that we get care of if it happens. But the conversations are just not happening. Any friend of mine, the conversation happens. My best friend actually, who had her daughter like 2 years ago, and she clearly was having issues. Her mom reached out to me. And it was all around breastfeeding and the stress of breastfeeding and just not being able to just kind of wrap her head around that whole thing. And she ended up getting on medication and seeking therapy. I don't even, and I feel bad because sometimes like I ask about the baby very last. It's like, I love babies, but how are you? How's everything going? Like, are you eating, sleeping?
So is the movie, like if someone listening, one of our students or a pharmacist is listening, how can they get access to the movie? How can they find it?
Actually, they can visit our website, darksideofthefullmoon.com, but it is available on iTunes and Amazon. So all they have to do is go on there and just search Dark Side of the Full Moon, and they can watch it. If they're an Amazon Prime member, they can actually watch it for free. Yes, it's there. And then if it's an institute, like a school, they would want to go on our website. We actually have a distributor, TUG, T-U-G-G. They do educational licenses, so they're able to sell a license to that university, and then it gives the students access to the film and whatnot. So if they wanted to incorporate that into a curriculum, we've had libraries buy it so that there's a copy at their library if somebody wanted to rent it. They just go to our website.
Okay. And it's darksideofthemoon.com.
Dark Side of the Full Moon.
Full Moon. Okay.
And then let's see. So have you talked to any doctors or places that are incorporating a protocol? I didn't know what they would look like or.
Yes. So since the film, so much has changed in the maternal mental health realm, good things. So yes, while none of the protocols are coming down from ACOG, which is like, big up here, and then it trickles down. It takes a while for that kind of stuff to happen. But we know that they're trying to move up the 6-week checkup that moms get to much sooner than that, because 6 weeks is just long of time. If they didn't have a C-section, they're not seeing their doctor till 6 weeks. I was lucky enough to see mine earlier because I had a C-section, so I was in there a lot sooner. Now we all see the pediatrician, right, within 3 days. And so pediatricians are picking up a lot more of that slack kind of that was happening, where the questions weren't being answered until much later in the recovery time. So pediatricians are really the front line. OBs, I mean, I feel like not so much. I mean, I just kind of feel like they're so focused on the medical piece of everything. Is mom healing well? Like, not emotionally, but like physically, is everything like okay? So yeah, some things have changed. I know a lot of doctors are giving out more educational information about it. They are asking questions now, and not necessarily a professional assessment like the Edinburgh postpartum depression scale, but more of just like, hey, are you having any thoughts that like are scary? Like, that's like a great question to ask. Intrusive thoughts are one of like the top symptoms of both anxiety and depression when it comes to moms. So asking that question and then kind of following up with her on whatever her answer might be, and asking every time. Because there's so many doctors that are so stuck on if they're going to have postpartum, it's going to be within 3 months of them delivering, which is not true. I mean, if a mom is not treated,
it could be.
She has it, but she's not treated. I had moms show up to my support group 2 years, 3 years after their delivery. I mean, they have a toddler now, but never dealt with anything. So now other things are happening, and it's like reopening up that wound again. I mean, they never healed from the first time because it was never addressed. And so I say throw the timeline out the window. It just doesn't matter. And then so many, because we use the term postpartum depression so much, people forget that you can have it when you're pregnant. And that was a big thing for me. I was like, clearly this is not postpartum because I'm pregnant. So what is it then that I'm going, what do I have? And so it's always important just to, even when they're pregnant, to ask, hey, how are you feeling? Are you having scary thoughts? Are you having panic attacks? Are you, and then it's so easy though for a doctor to say, well, you're pregnant. Duh, of course you're scared. It's like, but no, like that's not okay. That's just, it's not okay for a mom to feel scared when she's pregnant. Like, that's just not okay. And so getting to the root of why, so yes, they are asking the questions. Yes, they are giving out more information. I think the nurses are a little bit more aware when they have that time with the mom before the doctor comes in. Nurses are primarily female, which makes a very big difference in the interactions. I know I hear from women who've had a female OBGYN that it was a completely different experience all the way around than having a male OBGYN. So, it just depends, but I always tell my mom friends, say, hey, just ask as many questions as possible. And if you're not comfortable talking to your OB about something, find a new one. I mean, so many people are like, well, I don't really like my doctor. And I'm like, you don't like your doctor. Like, that person should be your best friend. Like, this is like life or death. I mean, you got to be able to ask them questions, but I feel like now moms just go online and like ask other moms. I mean, I see it all the time in my mommy Facebook groups that I'm part of. People are like, moms are taking pictures of their kids like rash and like, what is this? And I'm like, why? I mean, do you feel like I don't know. So for me, it's like, you need to have an OB that you like, and someone who you feel you can open up to and ask those questions to, that you feel will genuinely like listen to you and, and feel like whatever you tell them is super important, and not just, oh, you're pregnant, that's why, go shopping, you'll feel better, or whatever these crazy things that they're saying. It's like, no. So yes, it's gotten a lot better, but it's not there yet, but it has gotten a lot
Conversations
better.
are going. So then, I know you're in South Florida, but what kind of resources have you found most helpful for supporting moms?
Online-based support is actually probably the easiest to access, because that's the biggest problem, is kind of like the access to care. So whether it's they don't have insurance, or they can't get a therapist, or they are a new mom and they had a C-section and they can't drive for 10 days, or their panic attacks and anxiety is so crippling that they can't leave the house to go see a therapist, or just the idea of packing up their newborn and knowing everything to take to go because they don't have anyone to watch the baby. Like there's all of those different kind of things. And so, the teletherapy that's available now, and online support groups that are available now are really great. Postpartum Support International offers all of those things, PSI. And so I always tell moms to do that. To take advantage of those things, because they can be just as effective as in-person meetings. Because the whole idea is to I don't want to feel like I'm alone. Like I want someone else to tell me my story. Like I want to hear somebody else say, yes, I had intrusive thoughts, or, oh yes, I'm scared I'm going to like drop my baby, or, oh, I'm scared. Like I want to hear that. And it doesn't matter if you're in the same room as that person. Because as you hear words and someone saying that, you're just like, oh my gosh, yeah, it's good. I had the same thought yesterday and I thought I was crazy, And so that's like the biggest thing, is just feeling like you're part of a community of women that have experienced that same thing. It makes it less scary, and it makes you more willing to go seek treatment, which is ultimately what we want, all moms to do, is just seek out that treatment. So that's a good resource. I actually, I work full time for Healthy Mothers, Healthy Babies of Palm Beach County. And I actually coordinate their teen mom mentoring program. So I do work with mommies. I work with teen moms, but I work with them more on the mentoring aspect of it. I connect them with mentors. And what's interesting is that when I first was introduced to Healthy Mothers, Healthy Babies, I came into that conversation from the maternal mental health standpoint and said, hey, you're like the prenatal entry agency for our whole county, for like our Healthy Beginnings system. And so what are you doing? Like, are you talking to moms about depression? And they literally showed me this like book that they give to moms. And I think there was like a little paragraph. I mean, I don't even think it was in the table of contents. Like it was just a little paragraph. And it said, postpartum depression can occur if you have these symptoms. I mean, it was like the smallest little thing. And I was like, listen, I run local support groups at libraries for free, and mommies are showing up. Like they have no outlet. So, and you have access to all of these moms, more access than I do, than just promoting on Facebook. How can you help? And so I played a very big role in starting the Circle of Moms program for our county in Palm Beach. And so we do have support groups, in-person support groups for moms, both in English and Spanish. And we have like a little play area, so we have volunteers that come in and watch the babies while moms are in the group. So there are some communities that have local groups, and I see that happening more and more, because I'm still friends on Facebook with a lot of people in that maternal mental health realm. So I see all of them like starting local support groups and that, but it's hard. I mean, it's hard to do it on your own when you're not backed up by a larger agency.
Right.
Your time. I mean, it doesn't cost anything really, but it takes your time, and it takes an emotional toll on the person who's facilitating, which was a big thing for me. That's why I stepped away from it for a little bit, because I had actually had a relapse. I had a relapse 2 years ago. I was not pregnant. I had an 8-year-old, but I completely relapsed and had to go back on all my medication. And I'm currently still taking them, because I ended up with a bipolar diagnosis that was unknown to me. So I had to get out of it for a little bit. It was just became re-triggering for me to share everything. And so until I got stable, I kind of stepped away. I'm much better now. But yeah, it's just a matter of being able to make sure that these groups stay alive, or any of these resources just kind of keep going, because it's hard to get them funded. It's hard for people. I mean, mommies get really, really excited about doing a support group, but then once they get better and their kid grows up, they kind of like, I don't, because I still have moms call me and say, hey, is Moms to Moms still running? And I'm like, no, but Circle of Moms is available. So at least I have a place to send them. But personally, it's hard. I mean, it's hard to run all of those groups, especially in our county. Our county is huge. It's like 2,300 square miles. I mean, it's gigantic, and it's bilingual. It's culturally, it's very diverse. So that makes it can be difficult too. But.
So definitely pharmacists finding out what local resources they already have and then looking into groups that they could maybe partner with or share that hosting responsibility.
Absolutely. Moms are much more willing to talk to another mom first than talk to a physician. Peer-to-peer just works because they don't want to feel like they're being judged. And most of the doctors they talk to or will talk to haven't experienced what they're experiencing, especially if it's a male doctor.
That's why they need to see this movie.
Right. Yeah, male doctor. I mean, I have been in the same room with very passionate male physicians and medical providers that are on the front lines of this cause and are awesome. But when a mom has to initially open up, I find typically it's with another mom. It's not so much with their doctor, unless it's a female and like they're, and they're really close and have talked about other things too that are maybe not talked about all the time. But, it's not effective. You're like, hey, are you depressed? Like, I mean, the way you ask the question too is super important to have like, a little bit of empathy, even if you didn't ever experience it yourself. And so I actually taught a little seminar on how to be empathetic. I mean, how to have that bedside manner. I think with the amount of patients that doctors are seeing and the amount of even just the overload and, labor and delivery departments. I mean, it's just things happen so quickly and the nurses change shifts so much. It's just a very overwhelming, busy kind of thing. And so when you have a mental health thing on top of that, the mom can feel extremely overwhelmed, and it can actually make what she's going through a billion times worse. So it's hard to find that care that's, OB groups now are like so big that, you see like multiple doctors and and so it's hard. The consistency is hard. But we kind of just empower our moms to ask the right questions. I mean, that's kind of what we've done and that's sad, but we've kind of put it on the mom's lap to say, you're in charge. Like, you need to be the one to be like, hey, I have a history of depression. I need you to be asking me these questions like every time I show up. And that's sad because the physician should willingly want to do all of that. But I say you got to put your health, your health care, whatever, in your hands and tell them what you need. Be very about what you need. And I've helped a lot of moms do that who actually are bipolar and then get pregnant and they're on medication for their treatment. And so many of them just stop taking their pills because they don't want
pregnant. Yeah.
Pregnant. I can't take this. And but they don't put a plan together with their psychiatrist. Like, hey, this is how we're going to wean you off. And hey, but you can actually still take this at a lower dose and it's okay. Or they just stop taking it. And then they have a whole episode because of just stopping their medication without weaning off or whatever the case may be. So that's important too, to have a plan. I only know of one doctor, although this was like 3 years ago that I went to a conference and she was a psychiatrist in New York. And she actually would put plans together for patients that had previous mental health conditions that were medicated for it, how they would get pregnant and get through the pregnancy, and then what would happen once they delivered. Like they would show up to they were going into labor and in their diaper bag was a script for their meds to get on right away. No waiting for this, that, or the other. And they would either choose not to breastfeed because of that. The nurses were all made aware. This is why she's choosing not to breastfeed, because she has to get right back on her medication for her to be healthy. So, but moms don't think about that stuff. I mean, they don't, and doctors don't think to ask. I mean, I'm pretty sure my OB did not ask if I was on medication for a mental health condition.
Yeah.
And with so many pharmacist moms that we have, we can begin those conversations. We're all getting pregnant, having babies, growing our families. So as we're using the healthcare system and having our own experience with our doctors, like bringing that up, hey, can you ask me these questions and your other patients today? Like,
Absolutely.
like, let's get conversations going about our mental health. And then for pharmacist moms, like, that are in stressful jobs, a lot of them are these longer 10, 12-hour shifts, like being able to check on yourself internally or have others check on you. How are you doing mentally? Are you fatigued? Are you having mental workload overload?
Absolutely.
Just because you're in healthcare doesn't mean you're exempt from depression, anxiety.
Right.
No, we hear it all the time. You know, I was a nurse. I didn't think it would happen to me. You know, I'm a, you know, a mental health counselor. I didn't think it would happen to me. And they didn't ask for help either. I mean, it was the same thing. I mean, they knew by the book what was happening, and they still were like, I can get over this. I can just, you know, I'll be okay. And they weren't. They had to get, you know, they had to seek help. And so, yeah, even with people in the medical field, it does. This is what I say. It just does not discriminate. It just does not matter. None of it matters. There's no real way to avoid it. There's just a real way to plan for it and be prepared for when it happens. And that's really like what we want moms to do, is just prepare for if it happens. If it doesn't, great. But if it does, 1 in 7 is a really high number.
Right.
I mean, that's a high number. And when no moms are being asked those questions, think about how many moms are going through, I mean, pure hell and not saying anything and not being able to enjoy the first moments with their baby, which is what I feel I lost, right? Like the first 3 months, I barely remember I don't remember like anything from that whole 6-month period. Like, I didn't take any picture. I mean, there was no pictures hardly. There was like nothing. And it's just weird. Like, thinking back on it now, I'm like, oh my gosh, like I didn't take any like belly pictures. I didn't take like nothing. And it's just, it's so bizarre.
And it sounds to me like 1 in 7, there just needs to be more awareness. And I think that's the big, you know, a great purpose for the movie and for just you being around and sharing, and us, you know, hopefully releasing this to like share to more people. There just needs to be more awareness, it sounds like. So
Absolutely.
I think your movie even touched on men. Like, if the women have a mental health episode, isn't it more likely the man will as well?
Absolutely. And kind of almost like a compounded situation, because oftentimes, and when I would teach my educational classes to moms about postpartum depression, it was like a pregnancy class. 80% of that class was geared towards the dad, partner, whoever, to say, hey, you're likely going to recognize this first in the mom. And then when it is recognized and mom gets treatment and starts getting better, I mean, dad is now dealing with both newborn, taking care of mom who's not doing so well, maybe trying to get back to work, because usually the partner dad's going back to work first. So yeah, that can have a huge effect. But dads, the emotional toll on a dad or a partner or whoever is not addressed like at all. I mean, that's something that is hopefully, you know, in the next 100 years, that's addressed, but it's like barely touched upon. It's starting to get in the child books now and and those sorts of things, but it's just not like addressed, because they're like, how can that possibly be? I mean, it's all hormonal. And if dad's not pregnant, how is he experiencing? And there's just so many myths around, because we know even adoptive parents can experience a mood disorder. So it's not always hormonal. It's sometimes circumstantial. It's the environment that you're in. It's just what's going on, and just compounded with everything else, you know, it happens. So yeah, daddies definitely need to be, and they need to learn too. They need to be educated so they can recognize it in their wife or partner. Like, hey, you know, I know what's happening with you. We need to get you some treatment, or we need to just have you talk to somebody.
Yeah, definitely being observant of the things going on. Are they posting pictures? Are they, are they talking? Or are they too silent compared to how they used to be? Are they tearful? Are they crying? Things that just aren't them. Are they sleeping more than normal? Or I don't know, just you've got to look and then ask, I think, as well.
Absolutely. And making sure that I always tell my new moms, don't go to your 6-week appointment or your pediatrician appointment by yourself. Always go to bring somebody with you for a couple of reasons. One, if you are experiencing something, you might not tell the doctor everything that's going on. That partner hopefully will chime in and be like, well, here's what's really going on, or whatever. And then when the doctor is relaying information to you, you're going through a mental health crisis, you're not retaining any of that information, like none of it. And so when I had my emergency appointment, when I finally, after, I don't know, 6 months or 3 months, I was actually seeing a therapist, but it was this man who was so nice, but never asked me the right questions. And so I continued to lie to him about my symptoms. And then finally I just broke down, but my husband came with me. I mean, I didn't remember half the things that she said to me. And so he was able to kind of retain all the information for me. But it doesn't have to be the baby's, it could be anybody, but I always suggest don't go alone. Like bring somebody with you who you trust, who can help you kind of explain the situation and then help you retain all the information when you leave. Because it can be, I mean, even if you're not going through a mental health crisis or whatever.
I still with my 4-year-old.
And just having given birth and sleeping very well, I mean, you forget stuff, right? So bring somebody with you. Always.
Another thing I really liked that you incorporated after the release of your movie was the online self-care support group. So you had, I think it was Rise and Shine. Was that the name of it?
Ready, Set, Shine.
Ready, Set, Shine. Okay.
Yes. So one of my many endeavors. So what had happened was what I wanted to do was kind of get out of like the therapeutic side of it, where like listening to, like being in a support group setting where you're constantly listening to, all these things that moms are going through. It can be very emotionally draining for the host or facilitator of that. And so I kind of moved more towards empowering women and making sure that they're taking care of themselves and doing it more in like a community setting. And we talked about all kinds of things, right? Like what's your why? What are your goals? What do you want to do? We had accountability partners where we made vision boards and the whole thing. And it's, I'm so glad you bring it up because that kind of is tying into what I'm trying to do now, launching in 2020. Which is going to be more local, but I am doing a vision board party. We have our local mall here has a beautiful community area, rental place. You can rent the inside of the mall. And it's really cool. It's called Live 360 and it's really cool. And so I'm renting it out and I have like 50 tickets available for women to come to a girls' night out where we're basically making vision boards. So it's just a community thing where we can, girls can all get together and we can kind of just, talk about, what our goals are, and it doesn't have to just be moms. It can just be anybody, any professional women or any women in general. We're going to do like a meditation and, a couple other things. And then later on in the year, I'm going to be doing some wellness workshops. So a couple series is on journaling. And so that's kind of where I am now, is doing more of the meditation and just finding other ways to kind of help with any symptoms that I might have, because even when you're medicated, you can still have symptoms every once in a while. So I've gotten really into journaling and meditating. And so I kind of want to share that with other women, and through these workshops kind of build support group systems within those workshops. And then like just talk about topics and whatnot. So I'm starting at local. I'm going to just let it grow. And then hopefully I'll be able to take some of it online, kind of like how I did Ready, Set, Shine was a virtual based wellness kind of group. So I hope I can do that with this one too. But yeah, so that's kind of the outlook for 2020, which is exciting. And our film though is still being bought and still changing
lives,
which is great. It's been seen all over the world. We had a military base, I think in Japan somewhere, that bought it. So it is seen, so they do show it on military bases a lot, because there's so many moms in isolation who are having babies and don't have the support of the baby's father because of deployment or whatever it may be. And so how these support groups can really help in places like that, because they have so many other things going on too, and they're living in a country where they don't speak the language. Like it's a whole, that's a whole other thing. So a lot of military bases that have taken advantage of for their physicians or people on site to watch that film and kind of know what a mom there might be experiencing. So pretty cool stuff.
Well, you have a lot going on yourself. It sounds like you're still a very busy person. And so you mentioned the meditation and the journaling. So what else do you do for your self-care right now?
For my self-care right now, I've gotten really good at saying no.
Mm.
That is something that I've worked on now for the last 2 years, and I think now I finally have mastered it. I'm a people pleaser. I'm a yes person. I will do anything for anybody, anytime, even if it hurts me in some way. Like, it's just, I'm so like, just, I'm a giver. Like, that's just, it's always been my nature. But it has hurt me. I mean, there are some things where I just extend myself too much, and, you know, I try to fix it on the other end, and it's just, that's not how it should be. So, I every 6 months do see my psychiatrist for a med check. But the great thing about my psychiatrist is she's also like my therapist. And I do spend some extra time with her in my sessions to kind of talk through everything. And she's been really good about teaching me about my bipolar and how and why self-care is so important for me because of that diagnosis, and recognizing the signs and when I need to take a break. And a big part of that she recognized was me having to say no to certain engagements and just things that you really want to do, but you can't. Like, it's okay to sit on the couch like all day Saturday and do nothing. Like, that's okay. And I've had a really hard time with that in the past. Just like, I should be doing something. There's just something I should be doing. And I have a special needs child, which, you know, that adds like kind of a whole other layer of just, motherhood's just really different for me with her. So, but luckily I have a fantastic husband and great support system here that is able to help me. And I ask for help. Like, not only do I say no to people, but I tell people what I need, which is something I never did before. Like, I need you to do this for me if you can. And I know you can. So please help me with that. Don't tell me no, because I know you can. So yeah, asking for help and saying no are big important pieces of my self-care for myself. You know, I take baths and I do, like, you know, the manicures and pedicures and stuff, but for me, that's not really self-care. I mean, and I know it is for other people, but for me, that's just not, like, you know, really making sure my schedule fits, you know, where I am emotionally at the time, especially around the holidays. Like, all of my Christmas stuff is done. Like, I do that in November. That's just something I do in November. And then so I can actually enjoy the season a little bit more. And I know for some people, like, the shopping and all that is like part of their experience. For me, like, that just stresses me out. So for me, like, to know how I'm going to react to it is I need to just do it a little bit differently. And so recognizing those things, and that's where journaling helps too. It's just kind of recognizing, like, how is your mood today? You know, it's so nice. I mean, I haven't woken up feeling anxious in, you know, over a year, which is,
Wow.
I used to wake up anxious every single day. And so to be able to wake up and not feel like weighed down by anything is so important. And for me, that's medication. I mean, that for me, that was what helped me. And she explained to me, like, medically what it's doing to my brain, which I wanted to know, like, how I wanted to be educated on what do these pills do for me? Like, what is it? And she's very good at explaining that to me. And for me, that just, because I'm not a medicine taker. I mean, I never even took Tylenol. So for me to start on any of this, it wasn't like, oh yeah, hey, bring it on. I was so resistant to it, but I was suicidal. Like, I can't, like, something, you know, if this doesn't work, I don't know what I'm going to do. And it worked. And
so that's another thing pharmacists can do. They can help explain, like, what this medicine is doing. And, you know, yes, you can read all these side effects, but this is what you're experiencing now, and this is how it can help change. And
right. And a big thing for me, actually, when I had the emergency consult when I was postpartum with the psychiatrist who ultimately put me on medication, she actually said, because she just knew, I was a type A personality. She knew I was very in control of stuff, and I was very savvy on the internet. And she said to me, she didn't even say don't go home and Google it. She says, when you go home and Google this, here's what you're going to find. You're going to find that this antipsychotic medication is for all these types of people who have these mental health illnesses. You're not any of them. Like, that's not you. We're treating you with this very, very low dose. I mean, like super low dose, just to change your thinking so you're not obsessing over certain thoughts in your head, which is what I was doing. And that was key for me. If she would not have told me that, I would have ended up like that mom in my support group and not feeling
right.
and going, that's really scary. I'm not taking that. That's not me. I'll just get over this. So explaining that and then educating on what's going on in your brain, you know, why you're, you know, things are not firing properly. I mean, they use very layman's terms, which I really like. She used like the broken arm in a cast kind of scenario. Like when you break your arm and it's in a cast and they take the cast off, it's healed, but we don't tell you to go out and start, you know, throwing baseballs, right? It takes a little time for it to heal. So being gentle with yourself and incorporating that self-care, not going right back into, you know, what you think you can do, you can't always do. It's hard with motherhood though. It's like, well, I can't stop being a mom and my lunch is packed, my kids, and this is where asking for help can really help. And just saying, what can I do for you? You know, how can I help you? Can I make your lunch for you? Can I, you know, I mean, those are the things that I often, and people think I'm crazy. They're like, what do you mean? Like, you're not coming to my house for my kids' lunch. I'm like, but I can. Like, if you want me to do that, I will. Like that, I know that's a huge help, you know, where I'm going to the grocery store. What can I pick up for you? Like, you know.
That's such a different question than.
Call me if you need something, because no one's going to call you.
Yeah.
Say, hey, I'm going here. Do you need anything? I'm happy to pick you up something. You know, but don't ever say, call me if you need anything, because no one's calling you. I don't think I've ever called, and no one has ever said to me, and then like immediately I call them and say, hey, by the way, actually, yes, I need. Like,
I'd love some milk. Yeah.
Yeah, I do. I actually need eggs and milk. Could you go to the grocery store? I mean, like nobody's doing that, right? So it's really just being specific about the help that you can offer.
I so appreciate you sharing like your experience, your movie. Thank you for creating that. I think it's going to change a lot of lives and help save a lot of women.
Yeah, that's the whole purpose. And then we're hoping at some point, Maureen and I, our hope is that this film becomes obsolete and that we look back on it and go, gosh, remember when doctors like weren't even asking moms about what they were feeling? This becomes part of everything else that's so typically looked at and treated, you know, gestational diabetes, all of those things. It just becomes part of that, and it's normal, and it's just, it is. So hopefully we'll see.
We'll definitely include like your website on there so people can find you. And is that the best way for people to connect with you? Okay.
Absolutely. Yeah.
Okay. And I think they get to see what your plans for 2020 are, and that's really sounds fun.
Super fun.
Oh, awesome. Well, thank you guys. I'm Bryn.
I'm Heather.
This is Jennifer. Thank you for joining us on Pharmacists Out of the Box.
We'll see you next time.
Bye.